Everyone, welcome to episode 144. Today is a commentary on Dr. Jordan Peterson's view on ADHD. Here we go.
I don't buy it, except in these rare cases, is that we use amphetamines to conveniently modify the behavior of bored boys because we're too stupid to construct our education systems in a manner that doesn't drive them mad. Look, normal university students take Ritalin like mad in university because they learn that they can sustain attention, whether that's productive or not in the long run is a whole different issue, but they can sustain attention with less effort if they use amphetamines. Now, that's a degenerating game, fundamentally, like most drug use. And so, I don't buy it.
All right, so here's my commentary. I did some research on it, obviously, and as someone that has ADHD, coping without medication is extremely difficult for me. But I do agree with the fact that it is a degenerating game. And, people, and I guess I am too, to the point where you need or you want the methylphenidate or Ritalin or any other ADHD medication to actually give you the motivation to get things done easier than you would have if you don't have the right proper medication. So when I'm talking about medications, I'm talking about the actual DSM-5 test by a psychologist that's legally able to be used for all standardized university and higher education exams like GMAT, LSAT, MCAT, PMP, Project Management Professional, anything. And I don't believe taking a medication without proper diagnosis is appropriate. Just like down in the States where you can just pay any doctor to get Adderall. My friend brought Adderall from the States to Montreal, and he goes, yeah, I just have to pay like $60 and he just write me a prescription. So let's start. My commentary on this is what would happen to ADHDers, real ADHDers, if we go without medication. There are two parts to it. So today I'm going to do part one. When ADHD medication stops working, it's often due to a variety of factors, including changes in the individual symptom, dosage adjustments, or medication itself not being effective. This can lead to a return of ADHD symptoms like difficulty focusing, hyperactivity, impulsivity, or even other cross-diagnosed symptoms. It's crucial to consult with a doctor, obviously, psychiatrist, psychologist, therapist, to address the issues that you're having and explore alternative treatments or medication adjustments. So I'm just going to talk a little bit more detail about what happened when ADHD medication stopped working. Difficulty focusing, increased hyperactivity and impulsivity, mood fluctuations, because we have emotional dysregulation. We are very expressive, especially for the extroverts. The introverts gets more extrovert when they hang out with extroverts, ADHDers. So the mood fluctuation is one of the problems that comes when real ADHDers go without medication. So what to do? Obviously, talk to doctor, your therapist. Consider CBT, cognitive behavior therapy. I have mentioned again and again the importance of CBT as well as actual pharmaceutical medication. And those two mixed together, you will succeed. So don't underestimate yourself. The research I found says take medication breaks. In some cases, taking a temporary break from medication may help the body reset, but this should only be done under the supervision of a doctor. I had that many times before, actually, and I wasn't able to function. I couldn't get up. I had no motivation to do anything. It seems like my life was just like I can't explain it. It's just like there's no purpose to it, you know? Like I wouldn't be making this video without the methadone. So anyways, potentially side effect of starting medication is the rebound effects where ADHD symptoms return with increased intensity as the medication wears off. Also, there's withdrawal symptoms. Individuals may experience withdrawal symptoms such as fatigue, irritability, difficulty in sleeping, and a whole bunch of other ones. So the importance of monitoring it is to keep a journal, you can, or keep it in your mind. Communicate with all your doctors, psychiatrists, therapists. Keep them in the loop. Make it like an integrated medicine method. And that's going to help understand by working closely with a healthcare professional, exploring various treatment options, individuals can effectively manage their ADHD and find solutions that work best for their unique needs. So, in the end, what I'm going to say is, yes, Dr. Jordan Peterson is half right, but the fact that in his video, he opposed to using medication because in rare cases where you need to actually control the behavior of bored boys. I tell my dog, go have some rough and tumble play, like what Jordan Peterson tells you. So anyways, take care.